Hi everybody, it's Dr. Ruff. We are going to be doing this week's mini lecture on assessment from birth to 3. And then this will be going over your chapter 6, assessment and intervention in the pre-linguistic period. So in the first 3 years of life, often called the pre-linguistic period, this time is critical for communication development. So during this stage, infant and toddlers build the foundation for later language through social interaction, early vocalizations, and nonverbal communication. Assessment during this period focuses less on formal language and more on emergent communicative behaviors. So as the SLP, it's kind of fun walking in the first time when you're working with these kids and families. A lot of times if you're working with this age group, you're actually working mostly with the parent and doing parent questionnaires and child observations. But all those little sounds and giggles and coos and gurgles and laughs that we just saw were baby sounds are actually to SLPs very significant and can tell us a lot. So key goals of assessment birth to 3. The primary purpose is early identification of delays or disorders and determine the need for intervention. So clinicians aim to evaluate communication intent, such as requesting, protesting, or joint attention. So for example, if they're reaching, that's requesting. If they're pushing away, that's protesting. A joint attention is when maybe mom's reading a book and the baby's looking at the finger, or if mom goes, look, and the baby looks over there, that's joint attention, which is really important for communication because now two people can talk about something if they have joint attention. That's why joint attention is so important. We'll talk about that in a second. You can also assess social engagement and caregiver interaction. Again, social engagement is required, is necessary on behalf of the child. They want to be socially motivated because that's going to help them build language. If they're not socially motivated, such as maybe our little ones with autism, maybe that's one of the reasons why we see some language delays, among others, but it can be a reason. And then we're going to look for pre-verbal behaviors that predict later language. So we're going to assess. For early assessment is essential because intervention during this window can significantly improve long-term outcomes. There's a saying that you'll probably hear me say many times, but early intervention is the best intervention because the earlier we can get to a kid for whatever reason it may be, the more we can kind of limit the amount of time that they're experiencing those delays, and we can kind of start supporting their growth early on so there's less to catch up on, right? So core areas of assessment, pre-linguistic communication skills. Pre-linguistic communication skills. These are things, so before words emerge, children often communicate through eye gaze. What are they looking at? Gestures. Are they pointing? Are they reaching? Lack of gestures is actually an indicator that something might be going on. Vocalizations, cooing, babbling, grunts, ma, ma, ma. Lack of these sounds can be an indication that something might be going on. And turn taking. Before they're even saying words, you could actually have a little back and forth conversation with a baby. With like, nom, 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 nom. And then you talk to them and they wait. And then when you're silent, ma, 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 and they go again. That is turn taking already at the infant level. A key milestone is joint attention, the shared focus between a child and a caregiver, which strongly predicts language development. That's why I was saying joint attention is a big one that we look out for. Play skills. We're also going to look at play skills in this age. So play is a primary context for assessment. They're not going to sit and do a worksheet when they're 2. Okay, so we're going to look at them in the areas of exploratory play, which is from birth to 12 months, like mouthing, shaking objects. Functional play, which happens around 12 to 18 months, like using objects appropriately. Are they taking the shape and putting the shape in the box, in the shape hole, right? Symbolic play, 18 to 36 months, and that's going to be like pretend play, like maybe are they feeding dolls yet, or is there no pretend play? And delays in play development often parallel communication delays. So again, not always, anytime there's a delay, it's not always, it could just be a delay, but it is something for us as SLPs, we're going to want to note and pay attention to, just in case, right? Then we're going to look at receptive and expressive language foundations. So even before speaking, children can understand words and routines. Receptive language is one of the reasons why we like to do songs with gestures and do them over and over again, right? So we're building those routines. We're going to use sounds and gestures to express needs, which is expressive communication. So again, if they're like reaching towards the juice, right? That's expressive communication. They're telling us they want something. Clinicians observe how well a child responds to their name, ding ding, follows simple directions, and uses vocalizations meaningfully. So responding to their name, it's checking that, are they paying attention to us? Is there a hearing impairment? Once we've ruled that out. But sometimes with our autism kids, they don't respond to their name, even though they have perfectly fine hearing, but they don't understand socially why that's important. Following simple directions can be more significant. Maybe there's some like receptive difficulties going on, and using vocalization meaningfully. Are they in their own world, or have they understood that making sounds gets them something and gets people's attention? So caregiver and child interactions. Assessment must include the caregiver as communication develops with relationships. So important factors. We're going to look at responsiveness to the child's cue. Is the caregiver, kind of noticing things that the child's doing? Use of language modeling. Are they kind of, silent with the child? Are they attempting to talk to them? Are they expanding on things that they said? And again, this is a cultural note. Not all cultures are the same in this area, so just be aware of that, but it is something that we look for. And then turn taking and shared routines. Are we doing that kind of like maybe the songs back and forth, that kind of thing? Caregiver input through interviews is essential for understanding the child's ability across environment. And in fact, at this stage, again, a lot of what we're doing is kind of like standardized parent interviews or like structured parent interviews, as well as observation, which brings us to our next topic. Assessment methods. So we are going to look at naturalistic observation. We, as the SLPs with our trained eyes, are going to watch the child in play and in daily routines. And this is going to help to provide a more authentic picture of communication. We're going to pay attention to like vocalization use. Are they responding and looking to their parent? Are they playing with toys? How are they playing with toys? Is it developmentally appropriate? We're going to do caregiver interview. So we're going to gather developmental history. Was there a normal pregnancy? Was there any substance use? Was there an injury? And we're going to look at functional concerns. We're also going to identify strengths and priorities. So strengths of the child, priorities of the family. And we are going to also use standardized and criterion reference tools. However, this is rarer at this age, and we're also going to use them cautiously as very young children may not perform consistently in a structured setting. So like, we might be looking at like the PLS-5 or something as they get like a little bit older, but we're just going to kind of use it as a piece of our information because maybe they're shy. Maybe they would act totally different if you weren't there. So it has to be a whole picture, right? And then we're going to do dynamic assessment. So we're going to evaluate how the child learns with support, and we're going to help distinguish delays from disorders. Risk factors to consider. Child may be at a high risk if they have premature birth, hearing loss, neurological conditions, and limited social interaction. Now, limited social interaction doesn't cause language disorders, but it might not foster them if there is a little bit of a delay. And it's something we want to know because if there may be reduced social exposure, and maybe that's part of the reason of the delay, we also don't want to like label them with a disorder if that's kind of all it is. But normally it's just a factor. It's not the causing factor. These factors guide the need for closer monitoring of early intervention. Roles of early intervention. Assessment naturally leads into intervention planning. So key principles are to start early. Embed strategies in daily routine. You're teaching mom this. Our parents. Use family-centered approaches. They're not going to do it if it doesn't work for their family. And we're going to focus on functional communication, not just words. What's going to get you the most bang for their buck? So we did it. Very quick, 10-minute mini lecture. Hope this helps. Reach out if you have any questions, and you got this. Thanks.